Well, good morning, all. What a gathering, right? Amazing, and it's a great day here in the State House, and I'm not surprised to see the numbers because this is a really important piece of legislation. Two pieces of legislation, actually, continuing what has been a very robust calendar the last several weeks, several months. My hand's getting tired from all the signing, but that's a good thing. And today we're going to sign another couple of bills that are really going to make a difference in people's lives here around the state. So I want to begin by expressing my gratitude to Speaker Mariano, to Senate President Spilka, to Chairs Cindy Friedman and John Lawn, and other members of the legislature who worked very, very hard on this. We also were joined We're also joined by a number of members of the legislature, including Leader Frank Moran, Representatives O'Day, Kane, Paulino, Garbely, Donato, Howard, Honan, Schwartz, Tarski, Sangiolo, Hong, Barber, Roush, I'll get to the senators in a minute. Sousa, Davis, Vitolo, Kasner, Senators Cronin, Roush, Sear, Comerford, Chairman Rodrigues, and if I've missed anybody, I will be told, no doubt. Secretary Santiago, thank you. Lieutenant Governor Driscoll, thank you. Our Undersecretary for Health and Human Services, Dr. Kiami Mahania, is here with us, along with our Commissioner of Public Health, Dr. Robbie Goldstein, our Commissioner of Insurance, Mike Caljo, Governor's Counselor, Tamisha Sybil, and also we're joined by a number of partners. I mean, this is a huge couple of pieces of legislation that really affect broad swaths of our economy, in addition to impacting the lives of so many families. And so I'm pleased that we have partners here today: Matt Vino from the GIC, Audrey Gasteyer of the Health Connector, David Sels of the HPC. We have other leaders in healthcare, Sarah Iceland of the Blue Cross Blue Shield, Liz Leahy of Mass Health Plans, Emily Dulong of Mass Health and Hospital Association, Mike Curry of the Mass League of Community Health Centers, Amy Rosenthal of Healthcare for All, Tim Foley from 1199 SEIU, among others. Look, Massachusetts has been and continues to be a leader in healthcare and in healthcare access. We were the first state to enact universal access to healthcare, and today we are the state #1 in coverage, with 98% of our population covered. We're also ranked #1 for quality, for research, for innovation. In the past year, we've been ranked the best state to have a baby, to raise a family, to live as a woman. U.S. News ranked us as having the healthiest residents in the country. That doesn't happen by accident. It happens by action. It happens because of our policies, and I just want to underscore that because that's what today is about. It's another chapter in what has been part of our DNA here. So I want to thank the members of the legislature for bringing forward another couple of great bills for us to sign. And I just want to say that we lead in better health outcomes and health equity because we prioritize those things. We care about everyone's well-being. We recognize there's still work to do. There's always work to do. But in the last year alone, we've taken action on, and I speak for this we, represented here, maternal health, postpartum screening, long-term care, breast cancer screening, substance use disorder, mental health, and more. We've taken action to get over 50,000 people access to affordable health care coverage through Connector Care. And today we're taking more big steps forward because there's real work to do. Costs are rising throughout the healthcare system nationwide. This isn't just a Massachusetts issue, it's a national issue. But we're taking action here in Massachusetts. We know that patients are paying higher premiums, paying more in out-of-pocket costs, and they're having a harder time getting appointments. Nurses, frontline doctors, and staff are stretched thin. Hospitals, health centers, and health plans are financially stressed. And we've seen bad actors exploit vulnerable hospitals and communities. We spent much of last year working to get Steward, a greedy for-profit, out of Massachusetts, save 6 hospitals, save 13,000 jobs. It was a positive outcome. No other state did that. But we need to prevent that from happening again. And this law will subject for-profit providers to the same transparency rules as everyone else. Now, I can tell you as Attorney General, I spent years in court trying to hold Steward to this standard. And I'm glad that our laws will no longer be exploited in this way. We're also getting DPH and the HPC and CHIA and the Attorney General's office new tools for preventing another Steward in the future. The legislation that we signed today will also advance a fundamental improvement that we're seeking to make in our healthcare system, and that is supporting and strengthening primary care, foundational primary care. We know primary care is critical for improving the quality of people's lives, closing equity gaps, and also lowering costs for everyone in the system. And, frankly, in this country, we don't invest enough in primary care. But we're going to make a change here in Massachusetts and make sure through this legislation that we are making all efforts to invest everything that we can in primary care. Our goal is to direct more of our healthcare resources to primary care through both Mass Health and the private sector. We'll strengthen our primary care workforce, the frontline providers in both hospitals and community health centers. I know that consumers and patients are going to benefit. The prescription drug measures enacted today will have a real and positive impact on people's lives. This law is going to ensure affordable access to critical drugs for things like diabetes, asthma, and heart conditions, limiting it to $25 per month for brand name drugs. That's a big deal. That means real savings. And I want to thank the legislature for all the work in getting that done. It's also going to increase, importantly, oversight of pharmacy benefits managers, PBMs. And I've asked my new Commissioner of Insurance, Mike Keljo, to take a look at healthcare costs, and I know that this will give him and other regulators tools to do just that. These are priorities for our administration, for our legislative partners, for our state. And we're going to work together to improve healthcare, to lower costs across Massachusetts. And we're going to continue to be the national leader on healthcare. At this time, I want to recognize and bring forward somebody who's been a leader in healthcare for a long time, and I know he's particularly proud to be able to bring this across the plate, and that is Speaker Ron Mariano.
Thank you, Governor, and it's great to see so many healthy people here. We've been to a few of these, the Senate President and I, and I think we'll be opening up a booth on the front stairs and selling pens at a very big discount. We can make a lot of money on this. Listen, I want to thank Governor Healey and her entire team, especially Kate Walsh, who isn't with us today, but is certainly foremost in my thoughts of someone who has been a real guide for me in moving through the problems that we faced in healthcare. And we have faced some great problems. And I want to begin by just saying thank you to John Lawn and Cindy Friedman for their continued work on a very difficult process. These were two separate bills going in separate directions. And having done a ton of conference committees, I know how difficult it is to get a conference committee agreement on one issue. To be doing it simultaneously on two distinct issues is a challenge. And I think you witnessed the challenge But the perseverance and the cooperation between the House and the Senate delivers us two good bills. Two bills that address real needs. I want to begin by just saying to the governor how impressed I am that we even have a hospital plan after the Stewart mess. She was the lieutenant governor for a big part. I mean, the attorney general, I forget what we're all somebody up here, so it doesn't matter.
I think we are.
Yeah, we think we are, that's right. But she was the attorney general, and she chased Stewart as much as anyone. The fact that they were uncooperative was lost in the debate. And I read about our dear friend with the audit pencil making comments about a lack of zeal and vigor. Yet, if you look at every state agency, everyone cooperates with their numbers. The only ones that didn't was Stewart. And I think we were in court twice to get them to cooperate, and both times they refused. And I think there's still court proceedings in progress now. So we're here to say it's never going to happen again. It will never happen again, no matter how many outsiders come in and try and insert themselves into our healthcare system. It's not necessarily a bad thing. It brings capital, it brings innovation, but we want protection, and we have protection now. And I know the Senate has worked long and hard on the prescription drug issue, but I also want to say that the Secretary of Veteran Services was one of the first names on the prescription drug bill in the House. So he can wear two hats when he gets here. So it is something that we've been aware of for a long time. And it is a real tragedy to watch the independent pharmacies struggle. And they continue to struggle, and they continue to go out of business. And we're hoping that we can begin to resuscitate the independent pharmacy business in Massachusetts. There are a number of people who still want to stay in business. We hear from them. There are some people who want to get into the business. But we can't allow this system to continue where pharmacy benefit managers are contributing very little to cost reductions, yet continue to make an awful lot of money. So these are the things that we'll be looking at going forward. Our battle is not over. I started this, and I'm going to tell you, a long time ago, in 2006. And I've been doing it about every other year since. So I know it's not over, and there's a lot that will be done. And I look forward to working with the Senate and the Senate President as we both come at this from little different perspectives and different angles, but knowing that the goal is the same. The goal is the same: to reduce costs. When people go to the pharmacy, it shouldn't be a nightmare. It shouldn't be something that they worry about and fear for months because they don't know how they're going to get their prescriptions. We need to do a better job, and we will do a better job. So with that, I really say thank you to the committees on both the House side and the Senate side for sticking to what was a real challenge. There were times around July I thought, no way this is going to happen. But the perseverance of the two leaders in the House and the Senate have us here today. And I don't mean me. I'm sorry, Senate President, I mean your chairman.
You did a great job.
It truly is. And I'm going to say to Anna, actually read some off the first page. With that, I will turn it over to, I don't know who it is. I'll turn it back to the governor. You can't go wrong giving it back to the governor.
Well, thank you, Mr. Speaker. And also, welcome to all the new members. We had the privilege of administering the oath to new senators and new representatives. And like me, isn't it nice to come in and take credit for something that you didn't actually do? I do that all the time. Welcome. Welcome. We look forward to working with all of you. And with that, we'll bring up our Senate President Karen Spilka.
I second the thanks to Governor Healey and to everyone in the room today who contributed to these two outstanding bills. I'm not going to ask you to raise your hand, but I would bet that 9 out of 10 of you never thought we'd be here. Surprise. We said at the end, well, I hate to even call it the end of session because it wasn't. July 31st is not the end of session, and that's what the Speaker and I both independently said. We will continue to work because some of this work is too critically important to not finish it before the end of session, meaning December 31st. And that's exactly what we did. You think of all the bills that we did during that time period, we left nothing. We didn't leave any conference committee on the floor. We did all of them: economic development, climate, maternal health, opioid prevention, and I could go on so many others, including these two critical healthcare bills. So it's very exciting to be here today, and we will never say never because we know there is always another day to get something done. I've said that from the get-go. I'd like to also thank Kate Walsh, Secretary Walsh, for all of her hard work. I realize she never thought what she was getting into when she accepted being secretary, I'm sure.
Don't tell her.
You know, I know. I don't have to tell her, but she's done a fabulous job bringing her expertise. And also a thanks to Mike Levine, I know, who had a lot of guidance and input into these bills as well. So I want to thank the governor and the lieutenant governor for their signature today, making this the law. And I'd like to underscore a thanks to Chair Lon and Senator Cindy Friedman, whose unwavering determination is behind both of these bills. I do want to thank persistence, Senator Friedman. Your persistence paid off. It's something that is really important, and I know all of us take to heart that we need to keep this going and we need to keep making a difference. I'd like to also thank Senator Cronin, who was on both conference committees. Thank you so much for your hard work. And acknowledge Senator Sear and Roush, who are with us today. I won't repeat everybody else, but thank you, Governor, for doing that. I'd like to thank all of my Senate colleagues because they all contributed to these two bills as well. Very vocal, a lot of input, very robust input and feedback to Senator Friedman and others on the committee. So I think it's great. The Senate is a deliberative body, made better, I believe, definitely made much better by the ideas of everyone that serves. And I'm proud of the two products before us today, the two bills that reflect that, both from the Senate and the House as well. And I'd like to again thank Speaker Mariano, Chan Lawton, and our House colleagues for getting these bills across the finish line, because we know Massachusetts has always been a leader in healthcare. Again, I won't repeat what the governor said, but this is something that we can really be proud of. Do we have more to do? Yes. There's always more to do, and we will take up that banner this session and do more. But in Massachusetts, patients should always come before profits. And I'm proud that the Senate and the House came together to pass 2 bills that do just that. We are lowering the cost in so many cases of out-of-pocket costs for asthma, diabetes, and certain chronic heart disease drugs in Massachusetts, first in the nation to be doing this. We are reining in the costs of PBMs, Pharmacy Benefit Manager. Throughout the last few years, time and time again, you've all seen articles about how much of a profit these PBMs make at a cost to our residents. We are reining that in because they have increased drug costs for far too long. No resident should be forced to choose between prescription medication and putting their food on the table or a roof over their head. You would think this day and age that would not be an issue, but go to so many of the senior centers in particular, and that is still going on. These bills will help eliminate that. And we are leading the way in the whole country on providing some guardrails to protect both patients, communities, and employees on the toll that private equity can take. We know that there is still more to do. We are still learning more and more over the mess that Stewart left us. But we are taking huge steps towards making sure something like Stewart doesn't happen again in Massachusetts. Again, Massachusetts is leading the way on this. And I couldn't be prouder that we capped this historic session with these 2 critical historic health care bills. And I really look forward to seeing all the positive differences that these bills make for all of our residents, communities, and employees in every single part of Massachusetts. Thank you, and happy and healthy New Year to everybody.
Thank you so much. And now I'd like to bring up Amy Rosenthal, the Executive Director of Healthcare for All.
Thank you, Governor Healey. I'm so grateful to be standing here with you and the Lieutenant Governor today as you sign these 2 important healthcare bills into law. All of us at Healthcare for All appreciate your commitment to making healthcare affordable, accessible, and equitable for the people of the Commonwealth. I want to start by extending my gratitude to Speaker Mariano and Senate President Spilka for their dedication to healthcare issues throughout their careers and their work on these 2 bills specifically. Without their leadership and willingness to work up until the very end of the session, these bills would not have crossed the finish line. I also want to note that these bills are the direct result of the tireless efforts of Chair Cindy Friedman, Chair John Lawn, and their teams. I've had the opportunity to see firsthand how much Chairs Friedman and Lawn care about individuals, families, and their ability to access affordable, equitable care. Healthcare for All deeply appreciates these 2 healthcare leaders and their relentless efforts to improve healthcare for the people of Massachusetts. These 2 bills take critical steps to address significant healthcare issues that Healthcare for All regularly hears about from people in the community. And I want to highlight just a couple of these stories and how these folks will fare better when these new laws are in place. First, Healthcare for All received a call recently on our helpline from a woman who has had type 1 diabetes for most of her life. She said to our helpline counselor, "Right now, I cannot afford to obtain medications such as insulin. I am living a nightmare, and I feel punished. It costs me so much just to keep myself alive." Fortunately for her, the PACT Act has an important health equity provision that will help at least 100,000 people in the state who have diabetes, heart disease, and asthma by making at least 1 generic drug free of charge and 1 name brand drug available at $25. When this law takes effect, these proposals will immediately help people. I also want to mention that this proposal was a top priority for the Health Equity Compact, and I know there are many members here today, and their advocacy for this was essential. In addition to the no copay proposal, the PACT Act increases transparency around drug pricing, brings the prescription drug manufacturers and PBMs into the state's cost trends process, and gives more authority to the Health Policy Commission to examine the impact of high-cost drugs in our state. Second, for the past several months, Healthcare for All has been working in the catchment areas of the 2 Steward hospitals that shut down after the private equity-backed hospital system went bankrupt. Our canvassing team has talked to close to 15,000 people at their doors in the Neshoba Valley and Dorchester areas. People who are emotional and fearful about how they'll get care and now that their local hospitals have shuttered. The Market Oversight Bill takes important steps to safeguard our healthcare system. It defines private equity, strengthens the state's ability to review changes in ownership, including private equity acquisitions, and increases the likelihood of preventing deals that could harm consumers. Lastly, a Worcester resident called the helpline looking for assistance in finding a new primary care provider who accepts his new insurance. He had to switch plans because his primary care provider is accepting plans that are too expensive for him right now, and he couldn't afford them. The Market Oversight Bill gives our new Division of Insurance Commissioner and his team the ability to not only look at insurer solvency when approving annual health insurance rates, but now they will have the ability to factor in consumer affordability when improving them. In addition, the bill creates a task force to look at issues related to primary care access, delivery, and financial stability, something that we need very badly here in the Commonwealth. These are just a few of the important advancements in these 2 bills, and as we heard from the legislative leaders here today, we know there's more work that needs to be done. Healthcare for All stands ready to work with the Healey-Driscoll administration and both chambers to continue working on these important issues. So thank you again, and I'm eager to see the bill get signed into law, so I will turn it back to the governor.
Thank you, Amy, and thank you for Healthcare for All's tremendous partnership to the state on a lot of fronts. We'll move the desk in for signature. I know we were joking a little bit about some stuff, and there's a little bit of levity, and it's a new year, and that's all good, and I hope no offense taken by anybody. But you know, this is so serious what we're about to do, and it's so important, and I just feel very privileged as governor and proud that I get to stand with our legislature and be able to sign into law something that's going to make a real difference in people's lives. A real difference in people's lives.